Hello and good afternoon, all. I got a story from California, and it just proves how stupid they are. They created this problem, but now they're going to make it worse. But before we get to that, I'd like to thank all my subscribers and returning viewers. And if you're new to my channel and you like what I do, please hit the like button and subscribe. Now on to the story. California went from mandating vaccines to forcing COVID positive healthcare employees to work. Yeah, that's stupid. The California Department of Public Health issued new guidance allowing hospitals and health networks to force COVID positive healthcare workers to continue working if they are asymptomatic. Yeah, it's so deadly you have to get the poke. But now, if you're not asymptomatic, if you don't show any signs, you still have to work. Make up your mind. The department is providing temporary flexibility to help hospitals and emergency services providers respond to the unprecedented surge of staffing shortages. Hospitals have to exhaust all other options before resorting to this temporary tool. Facilities and providers using this tool should have asymptomatic COVID-19 positive workers interact with only with COVID-19 positive patients to the extent possible, the health department said in a statement. Let's have the sick treat the sick. Well, not too bad. Kind of makes sense. The health department, but then you're gonna have those people with COVID walking around the hospitals. The health department issued the guidance Saturday and outlines that healthcare workers don't have to isolate or test negative and can immediately return to work if they are asymptomatic. The guidance is in effect till February 1st and comes as the Omicron variant. Boohoo! Guess what? They're gonna have they're gonna run out of Greek letters soon because it's gonna mutate. It's gonna be like the flu now. Healthcare workers and patients need the protection of clear rule guided by strong science, allowing employers to bring back workers who may still be infectious is one of the worst ideas I've heard during this pandemic. And that's really saying something. Bob Schoonover, president of the SEIU California and executive director of SEIU California, said, according to CBS Sacramento. Staffing issues have plagued hospitals across the country as the Omicron variant of this virus spikes, including California, where vaccines were put in effect last year, requiring healthcare workers to get vaccinated or face termination. Health giant Kaiser Permanente suspended more than 2,000 unvaccinated employees. Okay, let's get rid of 2,000 employees, but then we're going to make the sick ones work. And October said those who have still not been vaccinated face termination this month. The president of the California Nursing Association, Sandy Rading, said health department move will put patients at risk. We are very concerned, she said, according to NBC Bay Area. If you have healthcare workers who are COVID positive, care for vulnerable population, you will spread the COVID virus inside the hospital as well. If we're going to set up for the surge, let's use protocols to have transmissions reduced, which means not have COVID positive people come to work, Redding added. Dr. Dr. George Rutherford, professor of epidemiology of the University of California, San Francisco, move is not unprecedented. This is about having infected people taking care of the infected people. We did this with Ebola in South Africa. We've done this before. Yeah, it does make sense. But I just think you caused this because you guys didn't want to have people. You didn't get the shot. Can't have to be fired. So let's get rid of 2,000 people. Now we're short of a lot of people, and we can't do it. So what do you think? This is stupid. They set it up for themselves. All the right thing to do. Please let me know down below. And if you made it this far, consider hit the like button and subscribe. And as always, be good, have fun, stay safe. Bye bye.